The Latinx community is facing daunting barriers when it comes to getting the coronavirus vaccine, and it's creating a public health risk. Chris Conte takes a look at the groups that are stepping up to help.
Significa el sol.
It signifies the sun.
From the early days of the pandemic, it was Latino Americans like Maria Carolina being hit hardest.
Es muy duro.
It has been so difficult living through the pandemic because the protection was just not there, and it was so easy for any of us to become ill.
Maria is a migrant farm worker in South Florida. She is also an undocumented immigrant. With no proof of residency, it was impossible for her and countless others to get vaccinated.
Tengo miedo.
My fear is that I'm going to get sick, knowing that I have to expose myself and work in the fields.
But
we quickly began our campaign to urge the governor to change the policy.
Thanks to the efforts of people like Mariana Blanco, that's slowly changing.
That left out vulnerable essential workers who, without the vaccine, would continue to experience escalating infection rates.
Mariana works for the Mayan Guatemalan Center, a nonprofit in Florida that has lobbied lawmakers hard to drop those vaccine residency restrictions. And it worked.
We had to really educate our community in making sure that they understood that this was simply for public health reasons.
Florida has now dropped their vaccine residency requirements altogether. 24 states have done the same, including California, Arizona, Montana, Colorado, Texas, and Ohio. As demand for vaccine decreases, more states are expected to loosen their residency requirements.
We were concerned from the beginning about equity.
That is Dr. William Schaffner, one of the nation's most prominent infectious disease experts.
Wherever you come from, we just want to get as many people who are here in the United States vaccinated.
He says any barriers that states can eliminate when it comes to vaccinations will only help to increase overall vaccination rates. In many places, there is now little to no wait to get the vaccine.
Our rate of improvement has slowed down. It's a little like saying we've harvested the low-hanging fruit, and each increment that we want to better ourselves, get up that tree, we're going to have to do a bit harder work.
This is a public health issue, and I think for a very long time it's been treated as an immigration issue.
Just another piece of the puzzle in this nation's race to vaccinate. I'm Chris Conte.
I'm Maya Rodriguez. While COVID vaccines now reach most of the country, one group isn't part of the rollout equation yet: children. But that's starting to change.
It's a family and a parent decision, and it's not the right thing for every parent.
Dr. James Campbell with the University of Maryland School of Medicine is a principal investigator for a clinical trial now underway involving more than 6,700 kids and the Moderna COVID vaccine. They provided this video of the Baltimore vaccine trial site, which had just 150 slots for kids, but received thousands of inquiries from parents trying to enroll their children.
I think the reason why we have had such an outpouring, so many families wanting to be in the study is because of the success of the vaccine so far in adults.
One of those families, the Mugueras. They were able to enroll their 8-year-old son, Christian.
We thought about it, and then for me, it was a no-brainer.
The Mugueras aren't just parents. They're also doctors themselves. They carefully reviewed information about the study beforehand, then talked to their kids about it.
I think for the children, ultimately, what was the most appealing to them was the fact that they get their life back.
The Moderna clinical trial is for children under the age of 12, broken down into 3 age groups: those 6 to 11 years old, 2 to 5 years old, and 6 to 20 months old. The groups get vaccines varying in strength, from a full adult dose to a half dose. Parents need to keep an electronic daily diary of any symptoms and commit to 1 year of follow-ups, either by phone or in person. So far, Charles Muguera's son only experienced some initial soreness in his arm from his first full dose of the shot.
It's going to change the game completely, especially if we get the children vaccinated. This is going to save millions and millions of lives.
One more front in the war against COVID. I'm Maya Rodriguez.
The role professional baseball is playing in getting people vaccinated. Next on The Race.